Hello everyone. Here we are going to cover an ultra important topic, that is vascular events of acute inflammation. Actually, in acute inflammation, two types of events takes place: vascular events and cellular events. Both these events are very important from university exam point of view. So you usually very frequently get long question on one of them. So every year, almost every year in your exam, you get one of the question either on the vascular events of acute inflammation or on the cellular events of acute inflammation. So here in this session, we are going to discuss the vascular events of acute inflammation. So let's start it. So I guess you can see we are starting the important topic, that is vascular events of acute inflammation. So you must know how to frame your answer in your university exam. So in this topic, first of all, I will tell you what is inflammation. If you don't know what is inflammation, how you can understand the vascular events of acute inflammation. So first understand the definition of inflammation, what is inflammation, then understand the classification of inflammation, the two type of inflammation, that is acute inflammation and chronic inflammation, out of which we are dealing with acute inflammation here. Then we will start the acute inflammation. Then in the acute inflammation, first I will tell you the cardinal signs, then I will tell you all the steps of acute inflammation. Among all the steps here in this session, we are going to discuss the 5 vascular events of acute inflammation one by one. In the end, we will prove them with the help of an experiment. The vascular events of acute inflammation will be proven with the help of an experiment. The name of the experiment is Lewis triple response experiment. We will see that also. So it's a long question usually asked in your university exams of second prof, or sometimes you can get a short question on increased vascular permeability, which is one of the important vascular event. So let's start it. So let's start with the definition of inflammation. What is inflammation? Now, to understand inflammation, you have to understand microorganism. Imagine any microorganism enters in human body. What is a microorganism? There are 4 types of microorganism. It can be a bacteria, it can be a virus, it can be a fungus, it can be a parasite. If any of them enters in human body, what does they cause? They all cause infections in human body. They all cause infections, the ill effects, the infections or the ill effects in human body. So that's why I call microorganism as terrorist. Who is the terrorist, by the way? Who is the terrorist? Terrorist is any person who is foreign and it enters the country's territory and start killing the country people or damaging the country people, causing harmful effects on the country people. So who is the microorganism here? Can I compare the microorganism with the terrorist? Yes. So microorganism is also a foreign particle and it can be a bacteria, virus, fungus or parasite, and it's causing the ill effects on the human cell, the host cell. So that's why I call it a terrorist. Now what happens when a terrorist enters in country's territory? You tell me what happens. Whenever any terrorist enters in country's territory, the army get activated. The army, the soldiers get activated. And the army, the soldiers fight with the terrorist. So here also the same thing will happen. So as soon as the terrorist enters inside the human body, we consider the human body as the country territory. So it is entering. So the army get activated here also in human body. So who is the army of human body? WBCs. White blood cells. Who are the soldiers here? The 2 type of lymphocytes, B lymphocytes and T lymphocytes. These are the soldiers. So basically there is a fight. There is a fight between the two people, between the two things. There is a fight between the terrorist and between the army. And now it depends who is winning in the fight. If the terrorist is winning in the fight, the person will have infection. And if the army is winning, the person will have inflammation. That is my topic right now, inflammation. So in short, inflammation is the body's defense mechanism. What the microorganism do to the human body is infection. What the microorganism is doing to the human body is infection. And what the WBC is doing to protect it, to prevent it, to oppose it is inflammation. So inflammation is defense for the infection. Now both the spelling are starting from I and I, don't get confused. Infection is what the terrorist is causing on human body. I mean the microorganism is causing on the human body. And inflammation is what the army is causing on the microorganism, the defense mechanism. So inflammation is useful for us. So define inflammation. Inflammation is the body's defense mechanism in order to eliminate The injurious agent. Injurious agent is the terrorist. In order to eliminate the injurious agent, followed by removal of the dead cell, necrotic cell, and repair of the damaged tissue. This is inflammation. Who is the army? The army is the WBC. So army is WBC. So inflammation is the defense mechanism. Don't learn the definition. Understand and describe in your own words. Now coming on the classification. We already seen the definition. Now coming on the classification of the inflammation. Inflammation is of two types. Acute inflammation and chronic inflammation. There are two types of inflammation. Now you can understand the differences between acute and chronic inflammation better if you take one example. The best example of acute inflammation is tonsillitis. Let's take an example of tonsillitis. I guess every one of us have experienced an episode of tonsillitis in our life. So we know how does it feel when we have tonsillitis, what are the symptoms. Now chronic inflammation, the best example is the TB. Now both of them are caused by bacteria. Okay. For example, tonsillitis is caused by bacteria Streptococcus pyogenes. Most common bacteria which causes tonsillitis. And TB is caused by a bacteria that is Mycobacterium tuberculosis. Okay. Got it. Now, tonsillitis is an example of acute inflammation and TB is an example of chronic inflammation. What do you mean by onset? Onset is the duration between the entry of the microorganism and the first symptom. So as soon as the Streptococcus pyogenes enters in the tonsil, it produces tonsillitis or the pain in the tonsil or the symptoms of tonsillitis within few hours. So your onset is very rapid. So as soon as the bacteria is entering, within few hours, it will produce the symptoms. But here, Mycobacterium tuberculosis enters the lung. It remains in the lung for months and months and months and maybe for years, many times. And whenever the immunity of the person drops, falls down, at that time it gets activated and causes the symptoms. So your onset is very late. So your onset is fast in acute inflammation, onset is late in chronic inflammation. Now coming on the duration of illness. So do you have tonsillitis in your life? I am having many episodes till now. So whenever we have tonsillitis, we take treatment or we don't take treatment, it lasts for 5 to 10 days. Okay, so your duration is short. But when someone have the TB, if the patient take the treatment, that is the DOTS, the minimum duration is 6 months and maximum it is up to years. Okay, so here duration is short in acute inflammation and chronic inflammation, the duration is long. Here the hallmark feature is edema. Whenever there is an acute inflammation, there is edema of that organ. You can see the tonsils are swelled, there is edema. In chronic inflammation, the hallmark is the granuloma. Granulomas are formed, multiple granulomas. So here the hallmark is edema, here the hallmark is granuloma. Tell me important cell in each of them. In acute inflammation, the most important cell is neutrophil. And in chronic inflammation, the most important cell is macrophage and lymphocyte. So I hope you got the differences between acute and chronic inflammation. So till now, I taught you the definition of inflammation. What is inflammation? And tell me the two types of inflammation. What are the two types of inflammation? Acute and chronic. So tell me, what is the definition? So inflammation is body's defense mechanism. Defense mechanism. So basically, it's the army. It's the army. And what are the differences between acute and chronic? Tell me based on the onset, based on the duration, based on the hallmark feature, and based on the cells which is involved. So onset wise, here onset is rapid. I mean very rapid. And here onset is delayed. The duration is more, the onset is delayed. Here the onset is late, delayed or late. So that is acute and chronic. Duration, it is short duration, it is long duration. Hallmark, here the hallmark feature is edema and here the hallmark feature is granuloma. The cell which is involved here is neutrophil, here monocyte, macrophage or lymphocyte. So this is what we have read till now. Now coming on the acute inflammation. In this session, I am not dealing with chronic. There is a separate video of chronic on the app itself. So please do watch that, please. So currently we are taking acute inflammation. So let's start acute inflammation. We have seen what is inflammation. We have seen the two types of inflammation. Now it's time to start the acute inflammation. Let's start acute inflammation. Now where does it occur? Acute inflammation can occur from head to toe, any part of the body. From head till toe, any part of the body can have acute inflammation. For example, here there can be meningitis, there can be encephalitis, there can be endophthalmitis, there can be rhinitis, there can be tonsillitis, there can be pneumonitis, there can be gastritis. Throughout the body, it can occur any organ of the body. Itis, inflammation of that organ. Now whatever organ having the inflammation, there are 5 cardinal signs which are present in that organ. The best example, I always say, for acute inflammation, the best example is tonsillitis because we have experienced it. So we can correlate. We have correlate. One of the acute inflammation we all have experienced, that is tonsillitis. Okay. So there are 5 cardinal signs. So these are the 5 cardinal signs of acute inflammation. They occur not only in tonsillitis, they occur in all acute inflammation from head to toe. But consider tonsillitis so that you will have an easy understanding. Okay. Now, whatever organ have acute inflammation, that organ becomes red in color. Can you see the tonsils become red in color? That the temperature of that organ become more as compared to the surrounding temperature, so increase local temperature of that particular area, particular organ, that organ swells up. Can you see the tonsils are swelled here? Okay, that organ is swelled up. There is pain in that organ. So whenever we have tonsillitis, we have pain in the tonsil. During deglutination, we have the pain, and there is temporary loss of function of that organ, not permanent. These are the 5 cardinal signs: redness, increased temperature, swelling, pain, and temporary loss of function. Now, this is the English language I taught you. Do you know Latin? How many of you know Latin? I don't know Latin, but examiner want you to learn the 5 cardinal signs in Latin language. I don't know why, but you have to learn them in Latin. So if you don't know the Latin language, just learn it. So redness in Latin is known as rubor. Increased temperature in Latin is known as calor. Have you heard about the instrument calorimeter? Calorimeter is an instrument which is derived from this word, and it is used to measure the temperature. So here the word is calor, increased temperature. Swelling is known as tumor. Don't get confused. This is not an English tumor. It is a tumor in the Latin. In English, the tumor is malignancy, but in Latin, the tumor means swelling. Pain means dolor, and loss of function is Functio Laesa. So there are 5 cardinal signs. The first 4 were discovered by a scientist, Celsius, and the last one is discovered by Virchow. Can you tell me the 5 cardinal signs? Rubor, calor, that is redness, it is increased temperature, rubor, calor, tumor, that is swelling, dolor, that is pain, and Functio Laesa. Make some mnemonic and learn that. So there are 5 cardinal signs of acute inflammation, not chronic. So head to toe, any organ having acute inflammation present with this, that organ becomes red in color, that organ becomes warmer as compared to surrounding temperature. There is pain in that organ. There is pain in that organ, that is dolor. That organ is swelled up, that is tumor, and Functio Laesa is temporary loss of function. So I hope you got the cardinal sign. Now, coming on the steps of acute inflammation. There are 5 vascular events and 6 cellular events. So total 11 events are there in acute inflammation. I will explain you all one by one. There are 5 vascular events and there are 6 cellular events. So total 11 events are there. In acute inflammation, total 11 events are there. In this video, in this session, we are covering the 5 vascular events. There is a separate video on the cellular events. I request all my dear students, watch this session and immediately after that, watch the next one, so that you will have a complete correlation of acute inflammation step. And there is a separate video on the chronic inflammation in which we have only 3 steps, not the 11. So only total 3 steps are there. It's a small portion, the chronic inflammation, watch that also. So watch all 3 videos together, the vascular event, this video, the next video, that is cellular events, and the chronic inflammation, so that it will be crystal clear in your mind all the steps of the inflammation. Let's start with the vascular events. Okay, what are the 5 vascular events? These are the 5 vascular events. I'm not reading them. I will directly explain you. And these are the 6 cellular events. So total 11 events, 5 vascular, 6 cellular. Now in your university exam, you get question either on vascular or on cellular, a long question. Examiner usually don't ask you both because it will be a too long question. In the entire 3 hours, you will be able to write that only. So either vascular events are asked, it is 5 to 6 pages long. Either cellular events are asked, it is again 5 to 6 pages are long. Okay, usually. But sometimes you can get an overall steps of the acute inflammation. You have to in short write all. So let's start it. Now listen. I will explain you all 5 in one master diagram. So you have to understand this master diagram. If you didn't understand this master diagram, you can't understand anything. So please understand it. I'm having a very unique way of explaining all the 5 vascular events of acute inflammation. I will tell you in the form of a story, a movie story. But you have to understand this master diagram first. Otherwise, you can't understand these 5 events here, the vascular events. Let me explain you. Can you see the yellow color portion here in this diagram? In this diagram, you can see this is the yellow portion. What is this yellow portion? You can see this. This one I am talking. It is the skin. It is the skin of any portion of the body. Just say in my body, this is the skin of this portion. For example, it can be any portion. So just for example, it is this portion. Everywhere we have blood vessel. So you can see a blood vessel just below that. Can you see the blood vessel just below that? So we have blood vessel everywhere. So this is the basement membrane of the blood vessel. You can see a blood vessel here. You can see the lining of the blood vessel by endothelial cells. These are the endothelial cells. You can see the lining here by endothelial cells. This is the lining by endothelial cells. Got it? And you can see here is the microbe. What is this? This is the microbe. I will call the microbe as terrorist. It can be bacteria, it can be virus, it can be fungus, it can be parasite, I don't know. It's the injurious agent. So I will call it. Why don't you call it a terrorist? It is a foreign particle which is causing harm to the body. So let's call it a terrorist. So where is the army? The army is the WBC. So where is it? It is present inside the blood vessel. In the blood vessel, we have three types of cells: RBC, WBC, platelet. Currently, I'm interested in WBC. I'm not interested in RBC and platelet. So these all the green color cells, can you see? This is my army. I mean, this is the WBC. So we have terrorist, we have army. You are thinking that why don't ma'am make them fight now? We have a terrorist, we have an army. Let's fight. Let's see who is winning. Let's see who is winning. If the terrorist is winning, the person will have infection. And if the army is winning, the person will have inflammation. Let them fight. Let them fight. But there is a problem, a small problem, a little bit problem. You will say, ma'am, what is the problem? You can see the problem here. See, the terrorist is extravascular. The terrorist is present outside the blood vessel. It's extravascular. And you can see the army is intravascular. It is present inside the blood vessel. So how they can fight? They can only fight if they can meet. If they can't meet, how can they fight? So we have to meet them so that they can fight with each other, right? We have to make them meet. So there are two possibilities. Either take the terrorist inside, take the microbe inside. No. It's a bad idea. If you take the terrorist inside or microbe inside, it will spread in all the organs. The person will have sepsis. We can't afford sepsis. Come on, all the organs will get infected. Blood is going everywhere. So from here, it will spread everywhere. No, we cannot do that. Let's do other way around. Let's do the other way around. What is the other way around? Take the army out. Yes, that's look a nice idea. So let's take the army out. Yes. So we will take the WBC out and they will fight with each other. Now it's not as simple as that. I have explained you like a story. So to take the WBC out, there are 11 steps. 5 vascular and 6 cellular. It is not one step procedure. We will ask the WBC to jump out. No, it's not like that. It requires 11 steps. So you got my point. So I will teach you 5 vascular events here. And there is a separate video on the 6 cellular events. The purpose of all 11 events is to take the WBC out and make them fight. How many of you got it? So if you got the master diagram, here I'm going to explain you the 5 vascular events one by one. Never forget your purpose. We want to take the WBC out so that it can fight with the terrorist. This is the purpose. So one by one, we will take the 5 vascular events. Okay, let's start the first vascular event. I will explain you all 5 here in this diagram only. We will do the changes one by one and you will appreciate the changes if you have understood the main diagram, the master diagram. Now appreciate the changes. The first vascular event, as soon as the terrorist is entering, call it a terrorist. As soon as the terrorist is entering, the artery below that, the blood vessel below that undergo vasoconstriction. It undergo vasoconstriction, but it is only transiently for few seconds. Transient vasoconstriction. You got my point. For example, this is my skin. Can you see the yellow skin there? This is my yellow skin. And there is a terrorist who is entering inside. It can be a bacteria, virus, fungus, parasite. It is entering inside. So as soon as it enters inside, now the blood vessel just below this portion, it gets afraid. Oh my God, what is this? And it undergo vasoconstriction. So vasoconstriction is due to sympathetic stimulation. And it is only transient. It is only for few seconds or few minutes. So if I look this portion from outside with my eyes, if I'm having a look at this portion, the blood vessel below this is undergoing vasoconstriction. So this portion look blue. This portion will look pale to me because there is less blood. No, it is undergoing vasoconstriction. It is known as blanching. What is it known as? Blanching. So step number 1 is vasoconstriction. Say, ma'am, it's transient vasoconstriction which leads to blanching. And you can see in the diagram itself. Step 2, you can see here. See here. Later on, vasodilation is taking place, but first vasoconstriction. Now vasodilation. Again, see, first vasoconstriction and now vasodilation. So second step is vasodilation. Now see, again, this is the terrorist. You can see the terrorist is there. The same portion which was vasoconstricted now undergo vasodilated. And the vasodilation is persistent. It's not transient. This one is persistent. Got my point? It will remain there for the next few hours. It will remain there. It is not transient like for few seconds. So it will remain there. So second step is vasodilation. Vasodilation means more blood. This portion have more blood. More blood. So if I see this portion now, initially if I was looking this portion with my eyes, that portion was looking pale to me because the blood vessel just below this portion is going vasoconstriction. Now if I look at this portion, it will look red to me because the blood vessel just below this portion, undergoing vasodilation. So now this portion is looking more red to me. So can I say out of the 5 cardinal signs, one of them is explained? Rubor. Rubor is there. Now I told you 5 cardinal signs. One of them is redness. So here redness is explained. It will remain red. And if I touch this area, it is warmer as compared to surrounding area. If I touch this area, it is warmer as compared to surrounding area because it is having more blood. It is having. So because it is having more blood, it is red and warm. I mean the Rubor and Calor is explained. Out of the 5, 2 are explained because of this step. Because see, vasoconstriction followed by vasodilation. Again see, first vasoconstriction which is transient and then vasodilation which is persistent. So till now I taught you 2 steps. I want to teach you 5 vascular events. 1, 2, 3, 4, 5. We have done with 2. The first one is vasoconstriction which is transient in nature. The second is vasodilation which is persistent in nature. So the vasoconstriction leads to blanching. It is only transiently, and vasodilation leads to rubor and calor. I mean redness and warmth. That area become red, that area will become warm. Coming on the third step now. Let's start the third step. Third step is increased hydrostatic pressure. So please understand, in a capillary, can you see this is a human capillary? This is the human capillary. There are 2 types of pressures acting. One is outward, one is inward. Look at the arrows. The outward pressure is hydrostatic pressure and inward pressure is oncotic or osmotic pressure, if you know. Okay. So hydrostatic pressure is due to water. Hydro means water, common sense. And osmotic pressure is due to protein. So this is a capillary. This is the blood vessel. This is the capillary. Now it contains water also. It contains protein also. The pressure due to water is outward, and it is known as hydrostatic pressure. It is due to water. And the pressure due to protein is inward. The protein attract water. So it is due to inward. It's an inward pressure. It is known as osmotic or oncotic pressure. We know that. It is Starling's law. It is common. I guess everyone knows that. Okay. Now, you tell me what was happening in step 2. In step 2, there is vasodilation. Okay. First, there is vasoconstriction, which was transient. It doesn't matter. Now, it's vasodilation, which is persistent. What do you mean by vasodilation? Vasodilation means this portion got dilated. You all can see this portion got dilated. Dilated means what? Dilated means more blood. This portion have more blood. More blood means what? More water. So this portion have more blood and more water. So which pressure will increase? Is it hydrostatic pressure which will be more in this section? Or is it oncotic pressure which will be more in this section? Say ma'am, in this section of the blood vessel, there is more blood, more water. So hydrostatic pressure is more. Normally hydrostatic pressure and osmotic pressure, they are equal and opposite. I mean outward pressure is equal to inward pressure. They balance each other. But now I am saying outward is more than inward because the vasodilation is there. Because of vasodilation, there is more blood, more water, outward is more, inward is remaining same. So there is an imbalance. So because of the imbalance, outward is more. Now the fluid will leak out. Can you see the fluid? Look at the arrows. Look at the arrows. The fluid is leaking out and getting accumulated here because the net pressure is outward. So fluid leaks out. You all can see. Look at the arrows. The fluid is leaking out and getting accumulated here. So that is increased hydrostatic pressure. Increased hydrostatic pressure. So if I see this portion now, if I see it is swelled because fluid is accumulated in this portion. The fluid leaked out from the blood vessel and accumulated here. Now if I see it is swelled, I mean the tumor, the third cardinal sign. Till now out of the 5, we have explained rubor, we have explained calor, and now I'm explaining tumor. So there will be edema. Edema, that is tumor. That is explained because of this. I hope you got it. So same thing is shown to you. So see the first diagram. This is a capillary. See the capillary, beautiful diagram. See, this is the capillary. See the lining of the capillary, the endothelial lining. It's continuous. It's continuous. There is no gap in that. There is no gap in that. And you see the 2 pressure. Outward is equal to inward. Both of them cancel each other. Both of them cancel. Now see the next diagram. In the next diagram, still there is a capillary. You see the lining is continuous, but here the outward is more than inward. See the thickness of the arrow. So it is a diagram. No need to say anything. Diagram itself is depictive. Everything is clear. So you have to draw such diagrams in your university exam. You can see, draw this arrow thicker than this. So it means you are giving the impression to the examiner that you know the importance of thickness. I mean here the outward pressure is more, inward is less. That's why you can see the fluid leaks out. Can you see the arrows? The fluid is leaking out. The fluid is leaking out. Look at the arrows and see the fluid is accumulating in the background, leading to tumor. This is the fluid accumulating in the background. This is known as transudate edema. Actually, edema is there. I agree it's edema. Edema is of 2 types, transudate, exudate. This one is transudate. What is exudate? I will explain you in the next step. Let me come on the next step, the 4th step. So till now, out of the 5, 3 are done. Step number 1, step number 2, step number 3 is done. 4 and 5 still to go. So step number 1 is vasoconstriction, which is transient in nature. Step number 2 is vasodilation, which is persistent in nature. Step number 3 is increased hydrostatic pressure. So what is the importance of these steps? Step number 1 leads to blanching, which is transient in nature. Step number 2 leading to rubor and calor. I mean the organ look red in color and it is warm as compared to surrounding area. Increased hydrostatic pressure leads to tumor, I mean edema, and it is transudate type of edema, not exudate. Now coming on the fourth step. Okay, let me ask you a question. Why we are performing all these steps? What was the purpose initially? I told you the purpose at the beginning of the lecture only, no? In the master diagram. Why we are performing all these stuff? You say, ma'am, we want to take WBC out. We want to take army out. We want to take this WBC's armies out so that we can make a fight between the terrorists, this is the terrorist, and the army. So ultimate purpose, we want to take the WBC out. A question should arise in your mind that, ma'am, how WBC will go out? You are saying we want to take WBC out, but I can see the endothelial lining is continuous. See, the endothelial lining is continuous. There is no gap. Normally, we don't have gap in the wall of the capillary. So if there is no gap, how WBC will go out? So create the gap. We have to create the gap. That is step number 4. So step number 4 is creation of gap. Creation of gap is known as increased vascular permeability. We will create the gap so that later on the WBC can come out. In this step, we are not taking WBC out. We are just creating the gaps. Now have a look on the diagram. In the diagram, you can see this is the endothelial cell. This is the endothelial cell. You can appreciate the endothelial cells. I want you to appreciate the gaps between them. I'm interested in the gaps. It is not continuous. I want you to appreciate the gaps. So creation of gaps. The creation of gaps is known as increased vascular permeability, and out of all the 11 steps, this is the hallmark step. Creation of gap is ultra important. How this gap is created, I will tell you the mechanism. I will tell you 5 mechanisms, but first understand the creation of gap. Now the gaps are created. Now, initially gaps were not there. So only fluid was coming out. Now from this gap, cells and protein is also coming out. Can you see the blue dots? All these blue dots. The blue dot is the protein. So protein and cell is also coming out. So edema will exudate. Edema was already there, but initially edema was containing the fluid. That edema is transudate edema. Now the same edema get exudated, it convert into pus. I mean, instead of fluid, it contains protein also, cells also. So this edema is known as exudate. Now see the 3 diagram. Please, everyone on the screen, concentrate. See, the first diagram is normal. See. The first diagram is normal. This one is showing transudate. This one is showing exudate. Please understand now. In the normal, you can see the lining is continuous. The lining of the capillary is continuous and outward pressure is equal to inward. They cancel each out. There is no edema. In the second diagram, still the lining is continuous. Still the lining is continuous. But outward pressure is more than inward. So there is an imbalance. So you can see only fluid is coming out and only fluid edema is transudate edema. In the third diagram, appreciate the gap. I want you to appreciate very small gaps. From this gap, the protein and cell is also coming out. So this edema is known as exudate edema. So what we have learned? We have learned initially, due to increased hydrostatic pressure, only fluid comes out. That is transudate edema. Later on, subsequently, due to increased vascular permeability, that is creation of gaps, along with fluid, the protein and cell also come out. So basically, this edema get converted into pus. And pus edema is known as exudate. How many of you got it? So same thing is visible here. So I taught you 4 steps till now. Please, out of the 5, we have seen 4 steps. Tell me what are the 4 steps we have studied till now. The first step is vasoconstriction. The second step, the vasoconstriction, which is transient in nature. The second step is vasodilation, which is persistent in nature. The third step is increased hydrostatic pressure. The fourth step is increased vascular permeability. Bracket mein you can write its formation of the gaps. So this is the 4th step we are studying right now. So due to first step, that is vasoconstriction, it will lead to blanching. The second step, vasodilation, leads to 2 things, rubor and calor. Increased hydrostatic pressure and increased vascular permeability. Both of them leads to edema. But this leads to transudate edema and this leads to exudate edema, and you can understand it well. So draw the flow charts and draw the diagrams in your exam. You're going to get full marks if you're drawing all these diagrams. Right, now there may be a question coming to your mind, ma'am, how these gaps are created? You told us the gaps are created. Okay, got it. From this gap, the protein is coming out, the cell is coming out, and it is converting the transudate edema to exudate. We got that. But how the gaps are created? There are 5 mechanisms to create the gaps. So before coming on the 5th and the last step, let me tell you the five mechanisms by which the gaps are created. So these are known as the 5 mechanisms of increased or altered vascular permeability. So rather than reading, I will show you in the diagrams and the videos. See, there are 5 mechanisms. Can you see this is a blood vessel? See, so here this is the normally this is the endothelial cell. See. This is the endothelial cell. Normally they are continuous with each other. There is no gap. Okay, now imagine this endothelial cell undergo contraction. This also undergo contraction. This also undergo, this also. So all the endothelial cells undergo contraction. So at their junctions, there will be gaps. So it will be like this. So this is the first endothelial cell. This is the second, this is the third, this is the fourth, likewise. Okay, so at their junctions, I can appreciate the gaps because all of them undergo contraction, vasoconstriction. So at their junctions, I can appreciate the gaps. So appreciate the gaps at the junctions. This is the most common mechanism. So the name of the mechanism is endothelial cell contraction. The gaps are formed due to endothelial cell contraction. Who's causing contraction of the endothelium? It's histamine. There is a cytokine which is required. The name of the cytokine is histamine. Because of histamine, the endothelial cell contract. So the gaps are created at the junction. Now cut this blood vessel and look from the side view. So let me show you the cross section of the same blood vessel. So you can see in the cross section, you all can appreciate this is one endothelial cell. Appreciate this is second endothelial cell. Appreciate both of them are contracting. I want you to appreciate the gap at the junction from which the blood is coming out. The gaps are at junction. So it is the same diagram in the cross-sectional view. So this is the first mechanism, you all got it. The second mechanism, endothelium is not contracting. Initially endothelium was contracting, no? It was creating the gap, but now endothelium is not contracting. You'll say, ma'am, how WBC will go out then? You are saying for taking that, you want to take WBC out. For that gaps are required. But if endothelial cells are not contracting, make some other way. So yes, here the terrorist is very strong, very powerful. Terrorist will come and it will cause the necrosis of the endothelial lining. Terrorist will cause the necrosis of the endothelial lining. But it is not necessary that terrorist is causing the necrosis only at the junction. It can be junction, it can be non-junction. It can be anywhere. And terrorist is challenging the army. Listen, I have created the gaps. Come and fight with me. It's like that. You can learn. You can understand. So if you cut the blood vessel and look from the side view, the cross section, you can see. What's the difference between the two diagrams? Here also you can see the lining is the endothelial cell. But the gaps can be at the junction, can be at the non-junction. Here gaps were only at junction. But in the second diagram, you can see they can be at the junction, they can be at non-junction. Coming on the third mechanism. This mechanism is known as endothelial injury by the injurious agent, by the terrorist, the second mechanism. In the third mechanism now, the gaps are not created by endothelium contraction, for example. And the terrorist is very weak. The terrorist is also not creating the gap. So you'll say, ma'am, then how WBC will go out? You are saying neither endothelial cell contraction is taking place. You are saying terrorist is also not creating the gap, but we want to create the gap. This time army is very strong. This time army is very strong. Terrorist is not very strong. Terrorist is weak. But now army is strong. So army will cause the necrosis of own body cell. That is endothelial cell and create the gaps and go out. Okay, later on it will go out. So this is the gap which is created by the WBC. The WBC will create the gap and challenge. It will go out and challenge the terrorist. Let's see, I have created the gap and came out to fight with you. So this is leukocyte-mediated endothelial injury. Leukocyte-mediated endothelial injury. If you cut this blood vessel and look from the side view, you can see like this. Can you see? These are the WBCs. These are the WBCs which are creating the gap at the junction as well as non-junction. The third mechanism. The fourth mechanism, no one will create the gap. Neither the terrorist will create the gap. No. Nor the army will create the gap. Nor the army. And nor the endothelial cells will contract. You will say, ma'am, what are you saying? You are saying neither the endothelial cell will contract, nor the terrorist is creating the gap, nor the army is created. So how the gap will be created? I'm saying gap is not at all created. You say, ma'am, gap is not created means how the WBC will go out then? WBC will go out without gap. Yes. You say, ma'am, how it is possible? How WBC can go out without gap? Is it possible? Yes, it's possible. So basically, WBC will enter inside the endothelium from this side. And from other side, it will come out. So cell to cell transfer. So see, this is the endothelial cell. You can see this is the endothelial cell. Endothelial cell I'm drawing here. These are the endothelial cells, okay? Endothelial cells. So basically the WBC will enter inside the endothelial cell in vacuole. Travel, and on the other side it will come out. Cell to cell movement without gap. Cell to cell movement without gap. It is known as transcytosis. Cytosis means cell within cell. Trans means within cell, that is transcytosis. So this is one of the mechanism, transcytosis, cell within cell. You can see here in this diagram, I have tried to draw the WBCs, the army. Okay, you can see this is WBC or army. It is entering here in the form of the vacuoles, and on the other side it will exit. And you can see the same diagram here. The WBCs are entering from the vacuoles and exiting on the other side without gap formation. Coming on the fifth and the last mechanism, nothing will happen. Neither endothelial cell is contracting, neither the terrorist is creating the gap, nor the army is creating the gap, and not transcytosis. See what's done? So basically, whenever inflammation takes place, angiogenesis takes place. It's a feature of inflammation. Whenever there is an inflammation, angiogenesis always takes place. You say, ma'am, what is angiogenesis? Angiogenesis is formation of new blood vessel at that site. So just suppose I'm having inflammation here, anywhere. At that portion, the new blood vessels are formed. And new blood vessels are the baby vessels. You know, baby, kid, small baby vessels. The new blood vessels. The new blood vessels are the baby vessels. So they are already leaky. There is no need to create gaps in them. They are already leaky. So can you see the fifth diagram? Can you see what it is shown? So in the fifth diagram, I can see, can you see the endothelial cell lining? Appreciate the lining of the endothelial cell. Appreciate the lining of the endothelial cell. Can you see this lining? Appreciate. Now you can see the nucleus is dividing. You can see the spindles. If you can see, these are the spindles. It is indicating. Now, I have not shown the spindles anywhere else. Here I have shown the spindle formation. Can you see the spindles? Appreciate the spindles. By showing you the spindles, I am trying to show you that this is a new blood vessel. No need to say. If I don't say it is a new blood vessel, it should automatically understood. Because the cells of the endothelium is showing the spindle formation. It is a dividing blood vessel. It's a new blood vessel. It's a baby blood vessel. So gaps are already there, automatic. So it's leaky. It's already the gaps are there. So what are the 5 mechanisms? Can you enumerate how the gaps are created? Tell me the 5 mechanism of gap formation. I mean, tell me the 5 mechanism of increased vascular permeability. What is the 5 mechanism? Can you enumerate the 5 mechanism? 1, 2, 3, 4, 5. Enumerate them. Enumerate the 5 mechanism. The first one is most common, endothelial contraction. All the endothelial cell contract. Because of histamine, they do the contraction. And the gaps are produced. 90% gaps are produced because of this. The second, they are produced by terrorist. Terrorist means direct injury. Direct injury by injurious agent. Okay. The third is by the army. The gap is not created by terrorist. It is created by army. It is known as leukocyte. Leukocyte means WBC. Leukocyte mediated injury. So here the gap is created by terrorist. I mean the injurious agent. And here the gap is created by army. I mean the WBC. And here the gap is created by histamine. I hope you are getting it. The fourth one, it is transcytosis. Transcytosis means cell within cell. Nothing is required. No gap. It is cell to cell movement. So WBC enter the endothelium from one side and exit from the other side. And the fifth and the last is angiogenesis. Angiogenesis means new blood vessels which are already leaky. And here it is due to VEGF. This one takes place due to VEGF. Vascular endothelial growth factor, VEGF. So that is the thing. Now see, I will show you all 5 in the form of the video. See the first one. Can you see? It is due to endothelial cell contraction. See. This cell is contracting. This cell is contracting. Both of them are contracting. So gaps are created only at the junction. Nowhere else. Appreciate the diagram I have drawn for you. So the gaps are created only at junction. Appreciate the endothelial cells are contracting. Mechanism number 1. This is the first mechanism. The second one, the gaps is created by the injurious agent. So it is at the junction as well as non-junction. Gap is everywhere. Appreciate the diagram we have drawn. So it is gap at the junction as well as non-junction. Try to draw it in your exam. Okay. The third one, the gap is created by the army. Here the gap is created by terrorist. Here the gap is created by army. Who is the army? WBC. See, the WBC is coming and creating the gap. WBC is coming and creating the gap. Have a look here. We try to draw this diagram. So at the junction as well as non-junction, the gap is created by the WBC. The fourth one is transcytosis, cell within cell. So can you see the vacuoles inside the cytoplasm of the endothelial cell? Appreciate this is one endothelial cell. Okay. And appreciate this is another endothelial cell. And appreciate in their cytoplasm vacuoles are present. So basically WBC will enter from this side and came out on this side. Cell to cell movement. It is known as transcytosis. And same we tried to show you here. Okay. So it can be at the junction. I mean it is no gap. It is cell to cell movement. And fifth one is angiogenesis. Angiogenesis is formation of new blood vessel. New blood vessel is already automatic leaky. We don't have to create gaps in that. It's automatically leaky. So how we identify this is a new blood vessel? This is not an old one. See the nucleus and see the spindle formation in the nucleus. Appreciate the spindles. I want you to appreciate the spindles here. Looking at the spindles only, you can identify that this is a new blood vessel, not an old one, and it is already leaky. It's already leaky. We try to formulate. So in your exam, you have to make this table and draw the 5 diagrams. What are the 5 mechanisms of gap formation? The first one is the endothelial gaps, endothelial contraction. Second is injury by the terrorist, that is direct injury. Third is injury by the army, that is leukocyte mediated injury. The fourth is transcytosis, and fifth one is leaky blood vessel, that is angiogenesis. So try to make this diagram and try to draw these 5. Now if you look at the diagram at the first instance, you may feel that all 5 are same, but now you have a thorough knowledge that there is a difference in all 5. Here the gaps are only at the junctions. So this is the first mechanism, that is endothelial contraction because of histamine, most common mechanism. Here the gaps at the junction as well as non-junction by injurious agent. So this is direct injury by the injurious agent, gap as junction and non-junction. Here WBCs are causing the gap, that is leukocyte mediated injury. Here the vacuoles are seen in the cytoplasm, cell to cell movement, that is transcytosis. And here the new blood vessels are there, leaky blood vessels showing the spindle formation. So this is the fifth one, angiogenesis. So try to draw the cross section of all 5 and enumerate them. So what we have studied till now, we have studied there 4 steps out of the 5. The 4 are done. I'm teaching you vascular events of acute inflammation. Come back. Let's revise. So the first step I taught you vasoconstriction, which is transient in nature. Second, I told you vasodilation, which is persistent in nature. Third, I have taught you is increased hydrostatic pressure. Fourth, I taught you increased vascular permeability. And fifth, I want to teach you right now. Okay. You've already seen this one leads to blanching. This one leads to Rubor and Calor. This one leads to edema. This one also leads to edema. But here edema is transudate in nature. Here edema is exudate in nature. We have already seen that. Now there are 5 mechanisms we have seen of increased vascular permeability. You know the mechanism. Now coming on the fifth and the last step. The fifth and the last step is stasis. Out of all these steps, the hallmark step is this one. Increased vascular permeability. Now this is the stasis. Now till now what has happened? The fluid already leaked out. The cell already leaked out, the protein already leaked out. What is left? Only certain cells are formed or they are left out. They will show the stasis. So last step is stasis. That will increase the viscosity of the blood. So we are done with the 5 steps. We will revise them again quickly. Now there is an experiment. If there is an experiment to prove the 5 step, tell me an experiment. So there is a scientist who is known as Lewis. Lewis has done an experiment known as triple response experiment to prove the vascular events of acute inflammation. So what does the Lewis has done? Lewis has taken a blunt object like the pencil. Let's assume this is a pencil. Okay, let me take. This is a pencil. It is a pen, but assume it is a pencil. So he has taken the forearm. So this is my forearm. So on the forearm, the Lewis has given a stroke. The Lewis has given a blunt stroke. Now I cannot give it to myself, it will hurt me. But the Lewis has given a blunt stroke on the forearm. So as soon as he has given the blunt stroke on the forearm, he noticed 3 things. That's why it is known as triple response. So where he has given the blunt stroke, now you can see this line. I guess you can see this line. So here that become red color. So that line become red color. So first response is red line. Can you see the first response is the red line? You can see it here. So first there is a red line where the stroke is given. So wherever the stroke is given, there is a red line. Now the area around the stroke also become red in color. So that is known as flare. So flare means area around the stroke also become red in color. First the line become red. First this line become red. Then the area around that also become red. And then the complete area swells out. Then the complete area swells out. You can try on yourself if it don't hurt on you. So this is known as wheel. So 3 things happen one by one. First, you can see we are giving a stroke with a blunt object. You see, first the line become red. It is known as red line. Then the area around the line also become red. It is known as flare. And then complete thing swells out. So no, you cannot see it here, but you can feel it. The complete thing swells out. It is known as wheal. Do you have any time mosquito bite? You have experienced? I have experienced many times mosquito bite. I guess everyone have experienced it. Yes or no? If you have experienced a mosquito bite or any insect bite, you may have experienced it. So the point we have the bite, we have red at that point. Then the surrounding area also become red and the complete area swells out as a reduced mode. So we can feel like that also. Okay. And so this is Lewis triple response experiment. 3 things happen one by one. Can you tell me the reason? Now you know the 5 steps now. Vasoconstriction, vasodilation, increased hydrostatic pressure, increased vascular permeability and stasis. These are the 5 steps. Now the 3 things which are happening is due to what? So first there is a red line. Why the red line is coming? The red line is due to vasodilation. First, it is a blanching which is unnoticeable because it is very transient, but red line is due to vasodilatation of the capillaries. Then the second thing is flare. Flare is also due to vasodilatation of the arterioles. First, the capillary dilate, then the arterioles dilate, and then the complete area swells up. That is known as wheal. The wheal is due to increased hydrostatic pressure, which is leading to edema. So that is the thing. So I hope you got it. So red line is due to vasodilatation of the capillary. The flare is due to vasodilatation of the arteriole, and the wheal is due to increased hydrostatic pressure. That is the transudation of the fluid. The same thing, you can see it here. So I hope you all got it. So we are done with the vascular events of acute inflammation. So let's revise it quickly. If this long question is coming in your exam, what you're going to write? First, write down the definition of inflammation. It's body's defense mechanism. What is the classification? There are two types of inflammation, acute and chronic, and you know the differences between them. Now, in the acute inflammation, there are 5 cardinal signs: Rubor, Calor, Tumor, Dolor, Functio, Laesa. I guess this is the Latin language I used, and you know the meaning of them. There are total 11 steps. Enumerate all of them. The 5 vascular, 6 cellular. Here we are discussing the 5 vascular. What are the 5 vascular steps? So first step is vasoconstriction. Appreciate the vasoconstriction, which leads to blanching. It is transient in nature. The second step, the same thing become vasodilation. Which was vasoconstriction here it is vasodilation. So second thing is vasodilation. It leads to rubor and calor. This one leads to blanching. This one leads to rubor and calor. The third is increased hydrostatic pressure. So which leads to edema. Which edema? Transudate edema. Outward pressure is more, inward is less. So there is the imbalance. Increased vascular permeability means gaps are formed. You can appreciate the gaps. From the gaps, the protein and the cells are coming out. So again, we have edema, but this time it's exudate. And there are 5 mechanisms to create the gaps. You know them. And finally, there is stasis. And to prove that, we have Lewis triple response experiment. You get a short note on that also. So that's all about it. I hope you got the concepts crystal clear. I tried my best to give you each and every concept here. So whether long question, short question, very short question, MCQ, you are 101% prepared for this topic. Have a look on all the questions. Thank you.